Tim Stanley is the Daily Telegraph's must-read columnist. He had a great COVID piece in today's paper, and he joins me now. Tim, they like to say the science is behind what they're doing to our school children. I don't see any evidence for the science. You know, wearing crummy masks hanging off your nose and having and being tested for something that 2/3 of a fully vaccinated population can get is about as pointless as it gets. What do you make of their proposals for English schools?
First of all, I'm still laughing at the idea that anti-vaxxers are racist, especially given that the British government has spent the last few months desperately trying to persuade non-white Britons to get vaccinated. But never mind. But that aside,
that's actually a good point, because it's been the same issue in New York, that the people who don't want to go along with vaccine mandates are overwhelmingly members of the African American community. That's actually quite a point.
And Labour MPs who were opposed to a mandated vaccine among NHS workers pointed out that if it's significant numbers of non-white NHS staff who are not taking the vaccine, then you are, through the back door, introducing systemic racism through your vaccine policy. So ironically, you end up actually being a bit more racist by trying to do this. Anyway, masks in schools, maybe the science is there. What I find strange is the science is so incoherent. So kids sitting inside a classroom must wear masks. Masks will stop the spread of this horrible virus. But me sitting in an office, which I'd rather not be doing, but me sitting in an office, I don't have to wear a mask. So why is one condition, it's a necessity, and another situation is not a necessity? It's that kind of incoherence which causes people to doubt the so-called science. Maybe I'm not saying the science isn't there, but with kids, we know that this disease affects them less than it affects adults. They need to get back to studying. And the other strange thing about it is that under the legislation, the mask mandate for school kids is going to end on January the 26th. Well, what happens on January the 26th to suddenly make COVID so non-transmissible within schools? Is it going to go on a skiing holiday? It's the lack of coherence in the policy, which I think undermines public faith in the science.
There's a lot of that about, but with respect to our children, I do think they have been made the victims of this thing. I mean, to an extent, old people have, because they were walled up with the virus and left there to die unsurrounded by loved ones. But there's no doubt there's been a huge increase in mental health issues. Children are very disturbed. Children live in a hyper-present tense, so they're not like when you get to middle age and the decades just start rolling by, so a lost couple of years doesn't really mean much. For children, this has been an absolutely terrible 2 years, and we're going to be living with the mental health consequences, I think, for a generation. Why is it okay to abuse children for a disease that's actually no threat to them?
It's not just mental health, it's educational development itself. Mental health, little harder to quantify, but educational development, in some kids' cases, that they've essentially lost 2 years of study, at least in a classroom setting, and that's going to put them back just at a point at which Britain was beginning to close the gap between higher and lower achievers, just as we were beginning to deal with those structural problems of poverty and education. So that's very frustrating. Why have children been asked to sacrifice so much? It's unclear, when the disease, in a way, kind of caught us a break by affecting the elderly and those with comorbidities more than kids. That ought to really be seen as an opportunity to keep life going for kids while keeping adults and much older people protected. Instead, everything was shut down for the kids. Now, one suspects that a key role in this has been played by the teaching unions, which have essentially said to the government, if you want us to go back to work, you're going to have to do things like mandating masks in schools. We all suspect that's what's really behind this. But is it really fair that the people who are least affected by the virus have, in terms of their life chances, paid the greatest price?
Yeah, I think you're right to draw a distinction there, because what you're saying, I think, is that teaching by Zoom is is ineffective, and going to school and being surrounded by people in masks, including the teacher, you don't pick up the social cues. Being able to see someone's face is as basic a social cue as it is. So he can't teach you, the history of the Ottoman Empire as effectively as he could if he had his mask off. That's the basic reality, isn't it?
Yeah. We had a big debate in this country a few years ago about whether or not the niqab should be worn in class. Personally, I don't mind if it is or it isn't, but there was a big debate about that. And one strong argument against it was that you cannot communicate effectively in a classroom setting if your face is covered. Fast forward several years, and it turns out that debate, like so many others, mental health, the rights of prisoners, civil liberties, all these things we were told for years really, really mattered, have gone out the window. Which is one of the things which has made me personally furious during COVID, is the way in which things that were drummed into us as so important, like earlier we were discussing racial differences between people and overcoming racial inequalities, so many things that we were told were important in the course of this disease have just been ignored or thrown out the window. And it shows you what people's real priorities are. Now, it's entirely understandable that people are terrified of a disease and terrified of death. We all are, of course they are. I'm one of nature's cowards. I can only get on an airplane if I've had half a bottle of whiskey inside me. So I get it. But this disease is changing, it's evolving, and it looks as though Omicron is actually far milder than the previous variant. So accepting the pressures on the NHS, which is a separate policy issue, and is to do with a lack of staffing, and is to do with a lack of places to put people, accepting the potential pressures on the NHS, really, society should be opening up much faster than it is. And especially when the one group of people who will be least affected by the mildest form of the disease are the people who are immediately getting hit by a new restriction in the new year, secondary school kids being forced to wear masks.
You made an interesting point just then when you said that in reference to the niqab debate, and that's certainly true in the Francophone nations, where they have been far less shy about what they order their citizens to wear. So that France, for example, banned, you can't go into a French government office and be served by someone in a niqab because they thought they couldn't do it. And Quebec, which is also Francophone, did likewise. It banned the niqab. You can't wear a niqab and work for the French government. Now, for the Quebec government. Now they've entirely reversed that. And they're actually saying facial coverings have to be worn. So there's no philosophical or ideological consistency. Is this all just about power, or is it that they genuinely have no clue what to do and they just figure that this time it's going to do the trick?
Look, I think they want to slow transmission. They believe the science is on their side, that this will help, and I get that. But don't forget the British government has also chosen a subtly different strategy, one that was forced on it by backbenchers, by the resignation of Lord Frost, and by the cabinet confronting the Prime Minister. But essentially the government has decided to follow the Swedish course of having light touch regulations which rely more upon people making the right choices for themselves rather than government telling them what to do. So although I agree with you, I find all this very frustrating and authoritarian, Britain is still much freer right now than it is in Europe. And the government has also calculated that the Omicron variant is out there, and you probably can't do much to stem transmissibility, which is why wearing masks in schools is so frustrating, because it doesn't fit with the rest of the policy that they're following. So in many ways, it's actually comparatively light touch. But I do think what they're trying to do is make people feel safe. There are many of us who now, it's not a question of feeling safe, but many of us have stopped caring. I don't personally care about Omicron. I get it, I get the mild cold. But there are lots of people out there who do care. So the government's trying to persuade them that they can go about safely by mandating the wearing of masks. And that's an Alice in Wonderland style situation to compel people to do something I'm not sold on how much difference it really makes, in order to make them feel safe about doing something that's probably quite safe.
Yeah, that's very well put. I don't, I'd be upset if I got a variant and I died. But right now, that's the breaks. I'd rather have life back, life in full. I miss life in full, and I'll take my chances with whatever the next variant is to come along. Thank you for putting it so clearly for us there, Tim.